You're listening to RX Inspiration, the show where we highlight pharmacists across the country making a difference in their communities. I'm your host, Manuel, and I'm coming to you from the home of pharmacy at the American Pharmacists Association in Washington, D.C. I'm joined today by APhA President Randy McDonough, who will be leading today's conversation. We are also joined by Melissa McGivney. She's the Associate Dean for Student Success and Professional Initiatives and professor at the University of Pittsburgh, as well as a member of the APhA Board of Trustees, and she'll be our co-host today. Our special guest is Kaitlin Yeates. She is the Director of Clinical Operations and Pharmacist-In-Charge at the Towncrest Pharmacy in Iowa City. I'm excited to hear what they have to say, and I'm sure you are too. So, be sure to leave a comment on anything and everything that you hear today. Maybe shoot us a like and subscribe, and let's get started. Randy, take us away.
Thank you. Thanks, Mason. I'm very excited about having Kaitlin on our call today. Kaitlin, as you heard, is our Director of Clinical Operations at Towncrest Pharmacy Corporation. And although she may have a home pharmacy, as she knows, she's responsible for all of our clinical work across all of our corporation. So with that, I'm going to start asking you some questions, Kaitlin, and welcome to our podcast today.
Thanks for having me.
Absolutely. Well, first of all, I'm sure people want to know, what is your position with Towncrest Pharmacy Corporation? Can you describe that?
I will do my best. I always tell people that I wear many hats, but my titles are Director of Clinical Operations for our Towncrest Pharmacy Corporation. So that consists of 4 community pharmacies, 1 telepharmacy, 1 wellness apothecary, and 1 long-term care pharmacy. And then my home-based pharmacy is one of our community pharmacies based in Iowa City.
Okay. So within your role as a Director of Clinical Operations, give us an example of what you said, many hats, but give us a standard day. What do you do?
Standard day, I'm usually on site at my practice site in Iowa City. So I'm usually on location, but can travel anywhere to any of our different sites if needed. Really overseeing in my Director of Clinical Operation roles all of the clinical services that we offer, whether that's vaccinations, strep, COVID flu test and treat, any grant-based or payer-based projects that our sites may be involved in, making sure that we have policies and procedures and a workflow in place to make sure we are successful in any of those avenues and services that we offer, and then actually going on site to train not only our pharmacists, but also our technicians and our support staff to make sure it is an all-inclusive approach to make sure we have the most success for our patients.
Kaitlin, that is wonderful. I often get the question is, how'd you get there? So, when people are thinking about the roles and responsibilities, particularly as community pharmacy is evolving, like how did you get from where you started to this larger role and this opportunity to impact this broader number of pharmacies and patients?
Yes, absolutely. I love to tell my story because for me, it's very linear. And for some people, I always hear that they kind of did a lot of things before they found their pharmacy home. So throughout pharmacy school, I had a lot of really impactful mentors, especially in the community pharmacy space, getting my start as a pharmacy intern as an independent community pharmacy in Cedar Rapids. And then I went on to complete a postgraduate community-based residency through the University of Iowa College of Pharmacy at an independent pharmacy in Waterloo. And that just kind of paved the way and gave me the foundational knowledge and confidence to step into my role after residency as the Director of Clinical Operations at Towncrest.
That's awesome.
Kaitlin, you talked about some of the services you provide. I don't know if you have a list of all the different clinical services that we provide at Towncrest, but could you talk about those services right now?
Yes, absolutely. So our large clinical services that we offer are, of course, immunizations. I feel like those have just become a staple for community pharmacies to offer, but we also take it a step further and provide vaccination reviews for our patients who come in to receive vaccines. And that is a mainstay across all of our locations, specifically at our Iowa City location, which is my home store. In the month of October, for example, we do 70 plus offsite vaccination clinics for local businesses and schools in the area, and then also encourage some of our other more rural sites to get involved in their community and provide vaccines to local businesses and schools as well. We also leverage the multitude of statewide protocols that Iowa has in place for pharmacists really to be able to practice at the top of their education. And that includes the strep, COVID, and flu testing, and then being able to prescribe treatment according to the protocol. We can do pharmacist prescribed naloxone and also pharmacist prescribed nicotine replacement therapy. We also provide long-acting injectables to our patients, whether that be antipsychotic medications, birth control, or testosterone, pursuant to prescription orders that we receive. And we're kind of trying to pioneer the space of medical billing for these services as well, and really leveraging our provider status with Medicaid in the state of Iowa to find an avenue for payment for these services that we are already doing and already providing to our patients.
That's a full breadth of services that we provide. But one of the things I'm interested in too is people want to know, are you getting paid? So can you talk about the different payment methods that we have? And you talked about medical billing, but what other things are we doing that we're getting reimbursed for the services we provide?
So some of our services are just strictly cash based, where we do charge the patient a fee for the services that we provide. We are also involved with Community Pharmacy Enhanced Services Network, and then specifically leveraging our partnership in Iowa to be a part of a payer program. So we do actually have an Medicaid MCO in the state of Iowa that is paying us to do initial and follow-up consultations with their patients every month who have been identified for mental health, diabetes, asthma, poor A1C control, and just really having the pharmacist step in and have that touch point with them every month to identify and resolve their drug therapy problems and close those health gaps that their insurance plan has identified that they have. And then we are also heavily involved in a multitude of projects with the APhA Foundation as well. So those are supported by grant funds to be able to offer services from CGM follow-ups and appointments to basic vaccine screenings that we're already doing in the pharmacy. So we really try to find an avenue for payment across payers or cash-based, or just kind of challenging the current model and starting medical billing ourselves.
Very good.
One of
Uh,
the things, if I could, Randy, one of the things that I've always really been impressed by of the work at Towncrest is this willingness to just jump in and try something new. That's not an easy thing to do. So can you share just a little bit about, how the roles and responsibilities of the staff, whether that be your technicians, the pharmacists, drivers, how does that fit into all these different services? Because it's really cool. And sitting here and hearing it, it's awesome. How how do all those different people fit into making that possible every day?
I would say we use the many different roles that people have to make it fit and to make it work. It does not just come down to me as overseeing clinical operations. It doesn't just come down to me as the manager, pharmacist in charge of that store. I heavily rely on my other pharmacists and my other technicians, and it all just starts with education. Like, hey guys, we're thinking about offering this service. Here's how it's beneficial for the patients. Here's how it's beneficial for us, and here's how we're going to make it work. And we're going to just have open lines of communication. What's working, what's not working, how can we make it better? Because of a lot of the times I might put the framework in place, but it's my other pharmacists, it's my other technicians that are identifying patients and actually carrying it out. And it's just so rewarding to be able to see that and then have them come back to me and say, hey, Kaitlin, I know you set up policies and procedures for flu test and treat, but I had a patient test positive and we didn't have any doctor's note to tell them that they didn't have to go to school because they tested positive for strep. And I was like, wow, you guys, that is great. Let's keep these lines of communications open. How can we continue to improve and provide a higher quality of service for our patients?
That's awesome. Thank you.
yeah. And one thing I will add too is, and that's just putting a little plug. We were the original Flip the Pharmacy in the country, where we developed a process to really free up the pharmacists and optimize the license and training of all of our staff, pharmacists, technicians alike. And then we also have worked on a workflow issues. We worked on a robust medication synchronization program, which is part of Flip the Pharmacy. What Kaitlin has done is now take that, so now we got those processes in place, but really fine tune the services, making sure that it's consistently applied within the practice, consistently applied across the corporation. So she talks about policies and procedures, which is one of my questions. You talk about going in and training people, but you also got to monitor and manage each site. Tell me what you do to motivate the different individuals within the sites to do the things we're trying to do? And if they're not doing it, what do we have to do to try to change that?
Yeah, I would say that's probably been our biggest challenge as our corporation has also grown because we have our Iowa City location that, has been doing the clinical for so long, is well received in the community and by other providers. And then we have some of our newer sites that were brought into the Towncrest family. And it's, yeah, getting them excited to use their education to provide that higher level of patient care. So I think it all does start with the training, making sure that they are comfortable using their skills and their knowledge, and then making sure they are confident in that. And then once they start to implement it and truly see the impact that they are having in their workflow by leveraging the clinical MedSync program, having that MedSync foundation that actually frees them up to feel comfortable spending 5-10 minutes talking about vaccinations with the patient, they will truly start to feel rewarded with the work that they are doing. So we have monthly clinical meetings across our corporation, since we are kind of spread out throughout Eastern Iowa, where we pull up stats. One of our large ones recently has been prescription drug monitoring for our controlled substances and doing Dispose RX, so a packet that can help get rid of excess medications, doing naloxone, since we have the statewide protocol that pharmacists are able to prescribe, and then making sure we are really upholding that corresponding responsibility to make sure those controlled medications are safe for our patients. So it has been so cool to see over the last 3 months our pharmacists doing the prescription drug monitoring and inputting those notes into our documentation system has grown each and every month. And I know it's so exciting when they see their name up on the board and they're like, wow, I really did 33 Dispose RXs this month. You don't really see it when you're in it. And that's why it's so important to show them the numbers and be like, you might not feel like you've come very far, but you really have. And here's the data to prove that.
Very good. One of the things I frequently talk about, Kaitlin, and you know this, and I showed you the questions in advance, but I frequently say that pharmacists have to be interventionists. And what I mean by that is they take their knowledge and skill to really identify, for lack of a better term, diagnose medication-related problems, medication therapy problems, and then use their knowledge and skill to resolve that problem. Can you talk about how we are demonstrating pharmacists as interventionists within Towncrest?
Absolutely. I love to talk about our internal documentation system called PharmClin. So we use that at every site across our corporation. And it's basically our own version of a health record for our patients. So their medication list ties in directly with our pharmacy dispensing software, and it also pulls in their diagnosis codes. And from there, we are able to create flags, which we refer to as interventions, while we are on the counter, while we are verifying prescriptions. I think some of the best medication problems we've been able to identify and resolve have been on the run. A patient comes in for a new prescription, they tell us something, and we're like, this doesn't quite add up. Let me reach back out to your doctor. Oh, you had a blood clot over the weekend and you're on Eliquis and you're about to run out and your PCP wasn't even aware of this. Let me contact them and make sure we get you a script so that you don't run out this next time and, potentially get readmitted. So we have a lot of those on the run interventions, also making sure that we're counseling patients appropriately. And then we also have another section within this documentation software for SOAP notes. So another area that I have worked really hard on is making sure we have templates in place for those common drug therapy problems that we identify, and make sure that it's not a burden for our pharmacists to put in a quick note and fax it off to the provider. In the Iowa City area, as I had mentioned, we're so well established with the providers in the area. We get probably 75% of our responses, if not more, back from the doctors when we make medication therapy recommendations. And it could be a dose change. It could be, hey, patient isn't tolerating this medication very well. Here's a potential recommendation that we could make for them. Hey, this patient, I had a conversation when he came to pick up his insulin, and I listened to the fact that I'm really tired of giving myself multiple injections a day. Hey, let's actually take the next step and talk about that. It doesn't have to be that way. There are more novel agents for you to be on. Let's discuss those. Let me reach out to your doctor and discuss those with them. For that patient, we were actually able to get him on a once weekly injectable GLP-1, and he was able to decrease his insulin dose by 50% and get rid of his mealtime insulin. So Um, it's just using that documentation aspect and having those quick templates in place where we're able to take that next step when we listen to the patient or when we identify something ourselves and be able to follow it to completion and kind of close the loop between other healthcare providers so we're not siloed as community pharmacists.
So here's my next question, a quick follow-up to that. What would you say currently in your site in particular, since that's the most mature site? You talked about all these different ways that you impact the patient and documenting it. How frequently is that happening every day?
Well, multiple times a day. I will tell you, if you walked into our will call area, you would be hard pressed to find a bag that doesn't have a note in it of some sort, whether it's we're counseling you on a new med. Hey, this medication that you've been on forever actually depletes an essential nutrient. Are you having side effects of that? Can we get you started on some professional grade supplements to help with that? Hey, I noticed your doctor actually decreased your dose of your blood pressure medication, but the blood pressure that came over on the electronic prescription is uncontrolled. Can we talk more about that? So I think it's really just pushing ourselves to not only identify the, wrong dose, wrong drug, those common issues. But if we have a patient who's been stable on therapy, really asking, are they at goal? Because I could tell you probably a lot of patients out there, even though they've been on medications for years and years and years, are not at goal. And so, how can we then step in as a pharmacist who see them every month to help them get there?
So is it true what I say? I go to every patient encounter as if to expect a drug therapy problem. Is that a fair statement?
It is. And I don't want people to think that drug therapy problems are this big renowned thing. Oh my gosh, we're going to bottom out this patient's blood pressure if we put them on this. It's could be as simple as a, hey, I see you haven't refilled your pen needles for your insulin in a few months. Can we chat about that? Oh, I never knew I was supposed to change those each time I inject my insulin. It could be small incremental things, and those small incremental things are going to build trust with your patients so that when the big thing comes along for them, you're going to be the provider that they go to with that question. You're going to be the one that they trust to act as the intermediary between them and their doctor.
Melissa, I just want to see if you had anything to add or have a question.
Yeah, Caitlin, I want to go back to something that you said because I will often get the question of the how. Like, how do you make all this stuff happen? And you started talking about the how you support the pharmacists and their teams. You talked a little bit about a monthly meeting. Could you go into a little more detail of what are the different ways that you support the pharmacists so that they feel confident in working and making all of these interventions? Because I'm thinking about those pharmacists that are new to this. So how does that transition look from where they might have been traditionally been to where you all are really intervening on patients each and every time you see them?
Yeah, so the monthly meetings are huge for us. It provides a large group setting, and we open those clinical meetings not only to our pharmacists, but also to our technicians and any of our staff that want to join. And that just allows us to show the numbers, show the data of the interventions that we are making, and then allows us to kind of put things on people's radar. Hey, this program is coming up. Be on the lookout for more of information or trainings about this. I also try to have one-on-one check-ins with our sites, just to kind of open the floor to them. Hey, what questions do you have? I know it can get crazy. I know it can get busy. You might be like, oh, I really need to make sure I ask Kaitlin about this. And then the phone rings and 5 people walk in the door and you forget. So just really having dedicated time with the sites to ask questions and always having kind of that open door, open email, open text policy to say, hey, if you have a question, give me a quick call. Normally, I'm at my Iowa City location. Let's talk through this. If you have a question about it, one of our other sites probably has a question about it, and we need to make sure that everyone feels confident and comfortable in what they're doing.
I love that. And so I've got one more for you, and I want you to think about students. And really, what advice do you have for those students that are saying, gosh, I think I want to be able to provide patient care. I want to do it in a clinical environment and may or may not be thinking about the community as a space to do that. What would you tell them?
I would tell them don't get discouraged. I know there have been many times that I have had setbacks because as a pharmacist, I feel like we're very type A. We like to be perfectionists. We like to do a good job all the time, and sometimes that's just not going to happen, whether that be of matters of your own doing or not. But just having confidence in your abilities. And I know as a student and even as a new young practitioner, only 4 years out of pharmacy, sometimes I look around and I'm like, what am I doing? Who made me qualified to do this? But it really all boils down to hard work. No one is going to work harder than you. And you just need to put the work in if it's something that you're passionate about, and find that passion and go forward. And also lean on your mentors, surround yourself with good people. I've been very fortunate to have mentors kind of just pull me along and say, nope, you're coming with, you're going to learn something today, even if you have no idea what's going on. So I think for students, just don't get discouraged and really seek out those people who align with where you want to do and where you see yourself going, because each of them could teach you something.
Kaitlin, as a follow-up to the discussion you just had with Melissa about preparing our staff, what about from another provider perspective? How are they responding to what we're doing? And do you ever have to have meetings or calls with them to inform them that we have this process of how we provide care to our patients?
Yes. So very early on, when I started at Towncrest Pharmacy in Iowa City, it was in the peak of COVID. I graduated into COVID. It has just been, a longitudinal thing that has been in the background of me being a pharmacist, it feels like. But we were doing the pharmacist prescribed Paxlovid, and then we had a pretty robust form that we made sure we collected pertinent medication list, serum creatinine labs for our patients we were going to be dispensing Paxlovid for, because, it was a newer medication. We wanted to make sure we were doing it appropriately. And I had reached out to a provider for a serum creatinine lab to make sure it was dosed correctly. And this patient was just under the cutoff of what was recommended for the dose decrease. And they had prescribed the full dose. And I'm like, I don't believe it's safe for the patient to be on this dose. Their labs are showing that they need the reduced dose. And I was on the phone with a provider and was asked, are we really going to split hairs about this? And I looked at Kelly, our COO, who was in the pharmacy that day with me, and I was like, oh my gosh. And she was like, call Randy. He loves getting clinical questions. I think he'll agree with you, but just call him. And so I called Randy and explained it to him, and he was just like, no, Kaitlin, you're right. And that just is really what gave me the confidence to be like, I am right. I will get a whole haircut about it. This is not safe for the patient. So that was when I really, had the confidence that we are the drug therapy experts. And I've seen other pharmacists struggle with this on basic things such as just requesting labs from some of our newer sites and some of our more rural sites where those providers aren't used to pharmacists asking these questions and saying, no, hey, I'm involved in this patient's care too. I'm one of their providers too. I want to make sure the medication I'm dispensing is appropriate for them. And I think just, again, talking about it in these clinical meetings, talking about our experiences, talking about it one-on-one has made some of these pharmacists also feel empowered and also feel confident to be like, no, this is my corresponding responsibility to make sure that our patient is taking a medication that is going to be safe and effective for them. I need this lab. So it's kind of across the board, but it's so cool to see where we came, 3 years ago when we brought some new sites on to where they are now, and how those pharmacists have really blossomed and become more comfortable, advocating for themselves and having confidence in themselves to be those interventionists.
That's a great story too, Kaitlin. Thank you for sharing that story. Makes me feel good that you still need to hear my voice like that, right? So thank you. But one thing you said that I want to make sure our listeners do hear. I take the therapeutic relationship of our patients very, very seriously. That we are the last, professional that might be able to, help them with their therapy before they ingest it, before they take it, even though it's been prescribed. And that we have a responsibility to make sure that this is the right medication for the right patient, it's safe and it's effective. And I go further to say, until you become that advocate, and many of us have done that for family members, we've done that for maybe close friends, where we may be in their power of attorney as it relates to health decisions. I've been in that role. And when you're in that role, you'll do anything you can to be that advocate for the patient. That's how we should take it with every single patient encounter as it relates to drug therapy. Take it to that level. And that's what you did. Even though the other provider said, are we splitting hairs? Yes, we are. We're talking about, is this the most appropriate therapy for this patient based upon the parameters that we have? And that takes a lot, right? That takes a lot to be able to stand up. And once you feel that confidence to stand up like that, and that to me is what I mean about being an interventionist. You don't back down. You stand for what you believe is right for that patient. So I think you exemplified that better than I've seen a lot of people do that. So thank you. So here's my last question for you, Kaitlin, and you didn't get this in advance.
Oh boy.
You know, I love practice, and I know you thrive on practice too. What would you tell our listeners and to our students and to residents or people deciding what they're going to do once they graduate? What's the value statement as it relates to being in the practice, and in particular, community pharmacy practice?
I frequently tell our students, our high school interns that come shadow, I love community pharmacy practice because you never know who is going to walk through the door that day and what problem they're going to come to you with. And what an awesome opportunity to be able to use the wide range of knowledge that you have gained in school on rotations through residency to help that specific patient with whatever need they might have that day and build that trust with them. And then ultimately build that therapeutic relationship that you were talking about, Randy, where they will come back and they will ask for you by name because they trust you because you advocated for them in a moment where they didn't know where to go. So they showed up at the local community pharmacy.
Yeah, I appreciate that. And thank you so much, Kaitlin, for presenting your expertise, your knowledge, and your experience to our listeners. I think this is truly an inspiration for all of us who are in community pharmacy practice to know where we could go with our practice. So thank you for your time today.
Thanks for having me.